Welcome back to ConceiveDoc. It's great to have you here again. I'm Dr. Eulalie Manket, a fertility specialist, founder of Clinique Notre-Dame de la Tendresse, Clinique NDT, and your host. In this space, we talk about fertility challenges, prevention, and treatment with care, clarity, and an open heart. My goal is simple: share insights from my 20 plus years of experience and empower you to make informed choices about your fertility journey. Last time, we dug into disparities in IVF outcomes for Black women and explored how tailored approach can help improve success rates. Today, I want to go a little deeper. We're talking about the unique fertility challenges Black women face, why they happen, and most importantly, what we can do about them. Let's start with fibroids, which affects up to 80% of Black women by age 50. Did you know that fibroids tend to show up earlier and grow more aggressively in Black women compared to others? Here why. Genetic and innate sensitivity to hormones like estrogen and progesterone are big factors. Environmental exposure to endocrine disrupting chemicals also play a role. And let's not forget chronic stress, often linked to systemic inequities, which can contribute to the progression of fibroids. Fibroids can distort the uterus, block fallopian tubes, and even disrupt the uterine lining, leading to miscarriage and preterm births. So, what can we do? Start with regular ultrasounds to catch fibroids early. Treatments like myomectomy and minimally invasive surgery can restore fertility. It's all about finding an experienced specialist to guide you. Next, let's talk about endometriosis. This condition is often underdiagnosed in Black women. Sometimes it's mistaken for fibroids and dismissed entirely, which is frustrating and harmful. Without a proper diagnosis, endometriosis can damage ovaries and fallopian tubes, trigger inflammation that affects ovulation, egg quality, and implantation. If you're dealing with persistent pelvic pain and irregular cycles, don't accept vague answers. Advocate it for yourself and push for a thorough evaluation. Early diagnosis makes a world of difference. Another issue is higher rates of STIs and cervical cancer among Black women. Untreated STIs or pelvic inflammatory disease can scar reproductive organs, and delayed cervical cancer screening often lead to advanced cases, complicates fertility preservation. Routine cervical screening, HPV vaccination, and early treatments are key here. Prevention really is the best medicine. Now, let's dive into chronic inflammation and PCOS, two other major challenges. Chronic inflammation, often tied to autoimmune conditions or metabolic disorders like obesity, can harm reproductive health. PCOS, which often presents more severely in Black women, comes with symptoms like insulin resistance, weight gain, and irregular ovulation. How can we manage this? Anti-inflammatory diet and regular physical activity are great starting points. Medical treatments like metformin and ovulation induction medication can also help. And don't forget vitamin D deficiency and chronic stress. Black women are more likely to have vitamin D deficiency due to melanin-reducing sunlight absorption. Regular testing and supplementation are simple, but powerful steps. Chronic stress, whether from racism, economic challenges, or societal pressure, raise cortisol levels, which can disrupt reproductive hormones. Finding ways to manage stress through yoga, mindfulness, prayer, or therapy can make a big difference. But here's the thing. Fertility challenges for Black women go beyond biology. Cultural and systemic factors play a huge role too. Infertility stigma in many Black communities discourage women from seeking help earlier. Historical injustice in medicine have created mistrust in healthcare systems, and economic barriers like high treatment costs and limited insurance coverage make care harder to access. So, how do we move forward? Advocates for expanded insurance coverage and culturally competent care. Start normalize a conversation about infertility in our communities. Education and open dialogue are so important. At the end of the day, addressing these challenges requires a holistic approach. Regular screenings for conditions like fibroids, endometriosis, and PCOS. Lifestyle changes like anti-inflammatory diet and stress management, and making fertility treatments more accessible and affordable. These challenges are real, but with the right tools and support, they are not insurmountable. Equitable fertility outcomes are achievable, and together we can work toward them. Thank you for spending this time with me today on ConceiveDoc. If something in this episode resonates with you, please share it with someone who might benefit. Don't forget to subscribe and leave a review. It really helps us continue this vital conversation. Until next time, remember, your fertility journey is unique and you deserve care that reflects your goals and individuality.